Okay, so I'm prescribing you a medication today called Toprol XL. You may have heard it referred to as Metoprolol, but basically this medication is being prescribed to help lower your blood pressure. You have recently been diagnosed with hypertension, which is basically the medical term used for high blood pressure. Someone your age with your background and health history is considered having high blood pressure with a reading that is anything over 140 over 90. And with you consistently having pressures over that, you have then been diagnosed with hypertension, aka high blood pressure. So, to explain how this medication works, there are things in your heart called beta 1 receptors. And these receptors respond to things such as stress or excitement, which can then trigger certain activities of the heart, such as increased contraction. Basically, this means it's causing your heart to pump harder and faster. And this is causing your blood pressure to rise. So, this medication is considered a beta blocker. And what this means is when taken this medication, it's blocking these receptors from responding to these activities, thereby preventing the heart from pumping faster and harder and preventing your blood pressure from going up. So, when you take a medication, it works its way into your bloodstream so that it can begin working. With this medication, it's taken in the form of a pill, which is how I've prescribed it for you. So it peaks and is at its highest level in your bloodstream about 1 to 2 hours after ingesting it. So different medications and how you take them will affect how much of the medication is absorbed into your bloodstream. With metoprolol, the kind that I specifically prescribed to you, the Toprol, specifically about 40% of this medication is absorbed and will end up in your bloodstream. Now, that number can go up a little bit if the medication is taken with food. So once the drug is absorbed, it can then be distributed to different areas of your body. Now, two of these areas for this medication, one is the blood-brain barrier. What this is it's a barrier that prevents certain things from crossing and then coming into contact with your brain. Metoprolol, however, is something that has the ability to cross this blood-brain barrier. Another thing in your body called cerebral spinal fluid, or you may have heard it referred to as CSF. It's basically the liquid that is outside of your brain and your spine and surrounding those two things. This medication, about 78% of it has been found in cerebral spinal fluid. So, what this means is that while this medication does affect your heart and how it works, it also has the ability to affect your brain based on the fact that it can cross into those areas. Now, once the body has used this medication for its intended purpose, it must then eliminate it. And most of this takes place in your liver. So before the medication even gets into your bloodstream and begins working, the liver has already started eliminating it. And this process is actually called metabolization. So for metoprolol, about 50% of the medication is metabolized or eliminated before it reaches your bloodstream. Now, it takes about 3 to 4 hours for half of the medication to be eliminated. This is called the half-life. For patients who have kidney problems or older patients whose bodies don't eliminate drugs as quickly as it used to, this process can take about 6 to 7 hours. Now, as with all medications, there are certain risks and side effects associated with its use. For metoprolol, common ones are blurred vision, chest pain, discomfort, confusion, dizziness. You could feel faint or lightheaded, especially when you're getting up from a sitting or lying position, slow or irregular heartbeat, sweating, and you can feel unusually tired or weak. Now, when taking this medication, it's very important to keep up regular visits with myself or another healthcare provider. We need to stay on top of your blood pressure, make sure we're checking it so that we can adjust your dosage based on the readings. And also, it's very important that you do not stop taking this medication without discussing it first with myself or another healthcare provider. This type of medication is one that you would want to taper off as opposed to just completely stopping it. So that means if it were a medication, like if it were something you were going to stop taking, we would gradually lower your dose until you got to a safe dose where you could just stop. And last, it's important to avoid drinking alcohol on this medication, and also make sure that other healthcare providers who are treating you for things, or if you're having a procedure, make sure that they know you're taking this medication, and leave it up to them to determine whether or not this is something that you will hold based on, whatever procedure you're having done. And then also, because we talked about, one of the side effects being dizzy or lightheaded, it is important that when you are getting up from a standing or lying position, that you take it slow and make sure you're not dizzy and you can safely do that. Now, as far as the pediatric or geriatric population, there hasn't been enough appropriate studies done on how this medication affects either population. Pediatrics, this is not a typical medication that I would prescribe for them. And as far as the geriatric population, just based on the fact that as our bodies age, our organs don't work as efficiently as they used to. So with the kidneys and liver function possibly being impaired, I would start at a lower dose until I knew what was safe. And that's about it. Do you have any questions?